Thank you very much indeed. And I've been looking forward to this day for some time. And so thank you for coming. Can I just ask, would you just raise your hand if you are caring at the moment for someone with dementia? Right, about half of us. And I think some of you have come who are struggling with dementia yourselves. And for that, I would like to thank you very much for coming, because I think it's a brave person who comes to hear people talking about their illness. But I hope that we won't hurt you. I hope we will encourage you. And that's the whole point of this conference, at least I'm assuming it is not to make us feel guilty, but to encourage us. Now I'm going to start. You should have have been given a quiz about dementia. And I'm just going to give you a very short time to fill in this quiz about dementia. You've been given pens as well. If you haven't got the quiz for dementia, it's on a separate sheet. They kindly copied this off for me. And you've just got a couple of 3 minutes to fill it in. If you want to collaborate, that's fine. If you don't want to, you want to do it by yourself, that's fine. And then we'll mark you out of 10 and find out who knows about Alzheimer's. But just go through it quickly, just ringing A, B, or C. A, B, or C. Have you all got a copy? Right. So this is just to get us into the mood. Don't agonize over it, just answer it. And a warm welcome to those of you who are online. And I hope that you've got a copy of that as well online. There's 10 questions there. Okay, let's go through the answers together. There are currently how many people living in the UK with dementia? 850,000. B. That's a huge number, isn't it? 850,000. So it's so important that we're here to discuss it. How many people are under 65 are living with dementia? A. 42,000. How many people living with dementia in 2025? 1 million. C, quite right. What's the financial cost of dementia to UK every year? £26 billion. Family and carers of people with dementia save how much? 11 billion, not million, but billion pounds. Percentage of people living in care homes who have a form of dementia. 64%. The Alzheimer's Society have dealt with how many inquiries in 16-17? Just under 40,000. That's a lot of queries, isn't it? How much have they spent or invested in dementia? A, £50 million. And we were accosted in Newbury yesterday with people from the Alzheimer's Society asking us to join them and help them. Doing a great job. Which of the following statements is true? B, dementia is a progressive disease. And which of the following are symptoms of dementia? All of them. Yeah, absolutely, all of them. So it is such a significant illness. So thank you very much indeed for coming. A recent Archbishop of Canterbury was on his way to New York, and he was being talked to by his advisors as to what he should and should not say. And one of them said, Archbishop, or Your Grace, do be very careful what you say, because people will twist what you say. And he was met at New York airport by his first press conference. The first question was, Archbishop, what do you think of the nightclubs in New York? And he saw this as being a tricky one, so he innocently gave a beatific smile and said, are there any nightclubs in New York? And the headlines the next morning were, Archbishop's first question in arriving in New York. What we say and how we say it matters, doesn't it? I did this phone-in program for Radio Solent on medical matters. And on one occasion, I was talking about malignant melanomas, you know, the skin cancers. And I said, those of you with black skins don't need to worry because you won't be troubled with this. It's only those of us with white skins. And I was reported to the Race Relations Board. And the complaint was that it was us white people on the BBC and you black people out there. And so it taught me a very important lesson to be inclusive in what I said. So I used the word those of us. And that was fine until I was talking to a lady about her hysterectomy. And well, I don't need to tell you the rest. You're with me, you're with me. But it's what we say and how we say it is desperately important. And I sincerely hope that we're going to communicate a lot better this morning than the Archbishop did or that I did on Radio Solent. Can you see this? Yes, I hope you can. These are some of the things, these are the synonyms for dementia. And they are really very hurtful indeed. So what we say and how we describe it. So the importance of saying, as a GP, I stopped talking about diabetics and epileptics because people are not defined by their illness. They are people with, as you well know, to talk about people living with dementia. Now, it is true that towards the end, unfortunately, a lot of sufferers are defined by the illness, but not so for a long time. And even when they're bad, they are still people with dementia. So let's look at the 5 different types of dementia. And I've said to Robin that if I'm going on and I do get carried away, as my wife will say, he's going to wave at me and I'll shut up. So Alzheimer's, the commonest form of dementia, 60%. And it is the one condition that we can pick up because when we do a scan, we can find these plaques and tangles in the brain. They're clumps of protein called beta amyloid, and they cause damage to the nerves and to the brain itself, giving rise to many of the symptoms. Although not all cases of Alzheimer's disease are known, a small percentage are related to mutations and of 3 genes, which can be passed down. And there are several genes, and we won't go into that, but one important gene is the E4 or APOE. You don't need to know that really, but just to say that they can be passed down, but not necessarily. So please, if you've got a family member with dementia or with Alzheimer's, please don't get unduly concerned. Vascular dementia. Vascular dementia is the dementia that you get because the blood vessels fur up to the brain and it causes damage. This is normally slower progression than with Alzheimer's. And people will often have high blood pressure, high cholesterol, and so on with that. And they have difficulties with problem solving, slow thinking. And note, these tend to be more noticeable than memory loss. And I think if I want to get one message across, it is that memory loss is only one part of it's sort of, as it were, an umbrella of a number of other things that happen to people when they've got dementia. Next one is Lewy body dementia with different clumps of protein found in the brains of people. Often if they've got Parkinson's or Parkinson's disease, and sometimes mixed with Alzheimer's as well. And the common signs here are acting out one's dreams in sleep, seeing things that aren't there, so visual hallucinations, and problems with focus and attention. The trouble is, so many of us have problems with focus and attention, don't we? Also, slow movements, rather like people with Parkinson's. And then there's the frontal temporal dementia. And this group perhaps is the more distressing. I don't know. It's invidious to say certain things are harder than others. But this is where you have the frontal part of the brain, which looks after personality, behavior, and language. And it seems the filter that we normally put in when we're talking to people, things we don't say, the things we do say, we have this filter, and it's excellent. But if that goes, then we often behave badly. And fun enough, we were staying in a B&B here in Crowborough last night, and the wife of the couple has a mother who's got, I think, frontotemporal dementia by the way she describes it, because her mum, who is normally very kind and generous, is now very much more irritable and difficult. And then finally, mixed dementia, just to make it even more complicated. Many folk with dementia have a mixture. So as you can see, it is not clear-cut. Dementia, in a sense, is an umbrella under which there are all sorts of variations. And as I'm going to say in my top tips, please beware comparing yourself with other people with dementia or caring for other people with dementia, because it does not go according to plan always. It doesn't always do that. It doesn't always do that. It varies. Right, let's move on to some of the symptoms that we may have. And we'll start with cognitive, which is the way in which the brain makes connections while remembering what is learned. My wife has huge cognitive powers. When I go out to meet someone and come back, she invariably says, so what about their family? What about husband, wife, their children? Are the exams being done? And I haven't asked any of that. She's got this ability to network, and that's what cognitive is often. And you women, I don't want to become too sexist, but I am. You women are so much better at that on the whole than us men. And so the cognitive things are memory loss, which is obviously usually picked up by someone else to begin with, difficulty communicating, finding words, difficult with visual and spatial abilities, such as getting lost while driving. That's quite a classic, isn't it? Which actually is often a very important sign, which moves the person with dementia from denying it to perhaps accepting it. And difficulty reasoning or problem solving. Mind you, again, these are only exaggerations of what most of us suffer from. And then difficulty handling complex tasks, difficulty planning and organizing, difficulty with coordination and motor functions, confusion and disorientation. So those are the cognitive things to do much more with the memory and so on. But then there's the psychological changes. And it starts off with, for some of us, personality changes, which are really very hard, perhaps more difficult than for their carers than for the person with dementia. Depression, anxiety, and inappropriate behavior. And then there's paranoia, agitation, and hallucinations. I heard not long ago about a man who had dementia, and he was walking past a mirror in their hall and saw himself but didn't recognize himself, and then accused his wife of having an affair with that man. And so they had to take the mirrors away. And it may be worth just thinking about where the mirrors come. Another of them is of course, that not in this particular list, but actually making sure the toilet door is painted a different color from the walls, so that when they go to try and find the toilet, they can find it. If it's the same color as the walls, they may not find it. And then there's disasters. I'm now going to go on to risk factors. And this perhaps applies to early stages, but I think they apply to the condition while it's progressing as well. And I'll try to illustrate that. So here are risk factors that can't be changed. The risk rises as you age, especially after 65. But it isn't, and I say isn't, part of normal aging. So just because we're over 65, some of us, then it doesn't mean that we have to have dementia. Family history, and we've talked about that, but many people with family history never develop symptoms. And then Down syndrome, sadly, is often associated with dementia, as is Parkinson's disease. And now, risk factors that you can change. I'm going to go through these quite quickly because I'm fearful of Robin waving at me. These are things that you might be able to control before you get dementia, but also they are worth looking at when someone's got dementia, because it can slow things down. Diet and exercise, diet and exercise is about everything, isn't it? every newspaper you pick up, there's something about it. But a good, healthy diet. Give up on the McDonald's. Oh, we stopped off at a service station on the M25 coming here, and it was an obesity center. It was horrifying, absolutely horrifying. I mean, the smell was bad enough when you went in, but the number of junk food that was being sold there was, I found as a medic, very, very worrying. Avoiding excessive alcohol use. Well, alcohol has a lot to answer for in many ways. And then these cardiovascular risk factors. These include high blood pressure, high cholesterol, and obesity, those three things. And they all affect vascular dementia in particular. And I'm going to come on to this, but I'll mention it here as well. Please, when you go to see your GP to start with, to maybe get a diagnosis of dementia, make sure that your GP looks at you or your loved one as a holistic thing. I know you're going to say, I tried. I'm sorry. It's true. But you know, dementia is only part of your loved one. There's a whole lot of else around that loved one, like the blood pressure and cholesterol and so on. Depression. Late life depression may indicate the development of dementia. And of course, people with dementia may get depressed. So it's a chicken and the egg situation. Diabetes, just important that people, you can't stop the diabetes, but you can control it, you can lose weight, and you can be very particular about maintaining your blood sugar level. And smoking, well, smoking is blamed for everything. And then the last two is air pollution and head trauma. Oh, they're not the last two. I'm not going to say very much about them, but this is one of the things that they're worried about with rugby and boxing and head injuries generally in young people, is the number of footballers who've been heading who end up with dementia later on. So if you've got a child or a grandchild who's playing, try not to worry too much about it, but do encourage headgear. And then this is the last three: sleep disturbances. People who have sleep apnea, where they stop breathing and then they gasp, and it often happens at night. You can have very good treatment for that. Of course, dementia causes sleep disturbance. The sleep disturbance causes dementia. So I'm worried because I'm not sleeping very well at the moment. Vitamin and nutritional deficiencies. Every single vitamin has been blamed or is the answer for every single condition. So just eat nicely. And medications can worsen memory. So again, if, as is probable, in the over 65s, there are medication of some sort. I can't remember the figures exactly, but the proportion of people over the age of 65 on one or more or many medications is huge. So do check with the GP that none of the tablets that your loved one is on, or that you are on, will make it any worse. And the last one, treating hearing problems. I'm going to come back to this again. If someone is hard of hearing, it's very difficult sometimes to tell the difference between that and memory loss, because I told you that. Well, of course you did tell them that, but they didn't hear it, did they? So it's not dementia. So if there's any hearing issue, please check it out and do something about it. Yes, darling, I will have something done about my hearing. Let's move on to prevention. And I'm going to speed through these. There are 9 steps that you may want to take. Keeping your mind active. My wife does Ken and Sudoku, and now everyone's doing Wordle. They're all good stuff. Keep it up. Be physically and socially active. There is evidence that when you're active, you release endorphins, which help you. And this is true for the carer as well. This is very important for the carer, that you keep yourself fit. And I'll come back to that again in a minute. Quit smoking, get enough vitamins, manage your cardiovascular risk factors. We've been talking about that, haven't we? Lose weight if you're overweight. I'm not looking anywhere. High blood pressure, so treatable. But you need to be a little bit more meticulous and a little less cavalier, maybe, about some of these things that you're doing. Treat other health conditions, and I'm going to come back to that in just a minute. Maintain a healthy diet. particularly the Mediterranean diet. I'm so jealous of the people who live in the Mediterranean. They seem to be fine. Good quality sleep, and back again, treating hearing problems. I can't say that enough. Treat hearing problems. They're not the be-all and end-all, but it's such an easy thing to treat. Although you may find that your dear loved ones are not very good at wearing the hearing aids. It's easy for me as a doctor. I talk about all the ideals. And then a patient comes along and says, thanks very much indeed, doctor. You're useless. It doesn't, I've tried that. It doesn't work. It's a bit like people with hearing aids and glasses now. When we were wearing masks, do you remember you took the mask off came the hearing aid, off came the glasses. Disaster. Right. I'm going to talk very, very briefly about diagnosis. Not so much about how they make the diagnosis, but what goes on in that first, second, or third visit to your GP. First of all, try and nurture a good relationship with your GP. I know you're going to turn around to me and say, that's all very well, Tim. Of course, when I was a GP, things were much better. But try and nurture a relationship with your GP and ask, please, may I come and see you? Might there be a way that I can communicate with you rather than the whole team? And check out whether texting or emailing is best. Ask them to treat other conditions. And thirdly, don't be afraid of being proactive. If you're a carer, be a bully. Be a bully on behalf of your loved one. Be a bully on behalf of your loved one. The NHS is busy, but you are representing your loved one. So don't be afraid of the GP, for goodness sake. Don't say you must be too busy for me to ask that question. And that brings me to the fourth thing. Please write down your questions before you go. Take 2 copies, one for yourself and one for the GP. If necessary, email your GP with the questions beforehand. You walk in and say, hello, Dr. Billington, nice to see you. Here are my questions that I would like to ask you before I go. Please. That's probably a message for me to stop talking, actually. You know, it isn't rude. And actually, as a GP, I found that very helpful, because otherwise you spend 10 minutes talking to them and they say, by the way, I've got some questions. And you could have answered these questions as you went through the other bits and pieces. And why do I say write them down for yourself? Not because you're stupid, but because you sit in the waiting room rehearsing what you're going to ask, right? And then you walk in and the daft GP says, good morning, how's your dog? Because you mentioned it last time and they're a very caring GP and they wrote down, don't forget to ask about the dog. And your mind then goes boing, 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 and you've lost all the 5 things that you wanted to ask. So write them down, don't be afraid. Okay, and then very quickly, drug treatments. Basically, there's no cure. There's no cure. But things like Aricept can be an improvement for 40 to 70% of people with Alzheimer's. Not all. No drug works on everybody. And it can delay things by about 2 years. Now, that may be quite a useful gap to have. It's, in a sense, it sort of slows down the development. And that may be very helpful for you as a carer to begin to make other preparations that may be necessary. How do we respond to the person living with dementia? Well, it's no good my talking to you. Robin will talk to you about that because he's got first-hand experience. And don't forget, you are the specialist of your disease or your loved one's disease. Don't forget that. You're the one living with it 24 hours a day. You know what works. You know what doesn't work. So you're the specialist. Don't be afraid of being proactive. I'll just rattle through Tim's top tips, which are on the other side of your dementia. Oh, sorry, the quiz, the other side of the quiz. Now, I'm sure you're going to say, Tim, I agree with 2 of them, but the other 8 are useless. That's fine. They're just my top tips. Beware, this is important, beware promising never to allow them to go into a home. You cannot promise that, so please don't. And if they have to go into a home at the end, you are going to have a huge amount of guilt to live with. Proactively build up a support team. We've talked about that with the GP. I think Robin will talk a little bit more about that as well. And when people offer to help, take them up immediately. We've just moved house and someone said, is there anything I can do to help? And Meryl said, no, we're fine. And I said, yes, there is. You can help me move the boxes out of the garage to the dump. And we booked a time and a date. And they say, is there any, would you like a meal? Yes, please. How about Tuesday? Just, they're going to be shy. You're in charge. Say, thank you. Yes, please. Now. Obtain a power of attorney if you can, while still mentally competent for both health and finance. Write or update wills. I've talked about this. Look after yourself physically, mentally, and spiritually. You don't need, basically, if you don't look after yourself, you will not be able to care for those you love. If you don't look after yourself, you will not be able to care for the person you love. So you can look at it as being altruistic, if you like. Start attending groups early, but not too early, to encourage acceptance. I know that lots of people with dementia find this a real struggle. Find music for your loved ones. I've heard about this with a playlist. And when they're being difficult and they won't go to bed again in the middle of the night, play them their favorite playlist. My friend Vic used to, when Sue wouldn't go to bed, he used to take her in her arms and dance with her. I would never dream of doing that because Mary would get more and more upset. But it worked for him. Find out what works for you. And I think Robin is probably going to say, don't argue, divert. And this is where it comes in. Is that right, Robin? Yep. And then pray when you are frustrated by the long, repetitive routines. You need help. And that's help that carers, other family members cannot deal with. But if you're a person of faith, if you believe in God, call on him. Call on him for help. You're going to need it, and he's there to help. And beware of comparing yourself with other loved ones. As I've tried to illustrate, they go at different rates. And if you start comparing them, you're either going to get smug, which I suppose is okay, or you're going to get depressed. And finally, get a hearing aid. And at that point, I'm going to stop. Thank you very much indeed.